Hi everyone, my name is Betsy Lordan. I'm here to talk to you guys tonight about advances in equine podiatry. So I'm just going to start off by giving you guys a little bit of an introduction to me, since I'm the newest member of the large animal team at SRH. Then I'm going to delve into the podiatry examination itself and discuss some of those nuances and more subtle things that we look at when we're looking at feet and kind of incorporating that into our overall lameness diagnosis. Then I'm going to talk about applications for shoes and specific diseases, including things like angular and flexural limb deformities and foals, acquired problems and infections, and then I'm going to touch on laminitis, which is a pretty important problem worldwide and very important here in this region. Then I'm going to move into a little bit of the barefoot debate. And I know barefoot is becoming increasingly popular with horse owners these days. And there's a lot of attention, particularly on the internet, and different schools of thought surrounding that. So just a little bit about me. I grew up in Gloucester, Massachusetts. And when I wasn't working deep sea fishing on the weekends, I was riding my horse. And so I got my BA in International Relations from Boston University. So I'm a little bit all over the place. But then I kind of followed that love of horses, and instead of moving abroad, I moved to Montana. And I spent about 5 years working on different farms and ranches, and there I really discovered my love for veterinary medicine and my interest in horseshoeing. So following that, I moved to Fort Collins, Colorado, and attended Colorado State University's College of Veterinary Medicine. And while I was there, I worked as an apprentice to a certified journeyman farrier. I also visited a number of popular equine hospitals across the country during school, and one of which was Rood & Riddle Equine Hospital. They have a huge podiatry department there, and after spending several weeks there, I got to see just tons of really interesting cases, and that really piqued my interest in equine podiatry. So after that, I did a year-long hospital internship at New England Equine in Dover, New Hampshire. I think I met some of your horses prior to my coming to work for SRH up there. I also worked with several local farriers on a lot of those cases while I was there. So after my internship, I received a really unique offer to move to Australia. So here's my international relations coming back into play here. I was offered a job working for Scone Equine Hospital, which is the largest equine hospital in the Southern Hemisphere. They employ over 20 equine veterinarians plus or minus seasonal staff. And I was hired to work for a subset of the practice called the Equine Podiatry and Lameness Center. So this practice focused largely on foot-related problems and how they relate to lameness. So everything from performance horseshoeing, those angular and flexural limb deformities I referred to earlier, acquired diseases, and laminitis, of course. So I'll just tell you a little bit about my stay in Australia, just to give you a little bit more idea of my background. I was in the Hunter Valley, which is about 2 hours northeast of Sydney, or west of Sydney. And the Upper Hunter region is home to the city of Scone, which is the horse capital of Australia. It's one of 3 internationally recognized breeding centers for thoroughbred racehorses. Scone itself has a population of about 5,000 people and 10,000 thoroughbred breeding horses. It's second only to Lexington, Kentucky in terms of the concentration of thoroughbred horse studs and the quality of the bloodlines. The average value of the yearlings coming from these studs approximates about $100,000 a piece. Scone is also home to the Australian Stock Horse Association headquarters and home to many New South Wales polo clubs. Based on that density of horses, you get to see a lot of horse feet. So while I was in Australia, I decided I didn't want to restrict myself to just the farrier world in a hospital environment. I got really involved with the Australian Farriers and Blacksmiths Association. I even did some competing while I was down there. I became the secretary of the New South Wales chapter of the AFBA and was a regular author on veterinary articles for their national newsletter, The Hammer and Steel. And then I worked closely with the organization, and we created a lot of anatomy clinics and educational events for local farriers in that area. So I think it was really neat to try to develop this team environment where we're all kind of working together and trying to all provide each other with useful information to move our professions forward. So that's enough about me. I'm going to delve right into equine podiatry now and just get into the meat of the conversation. So in the Middle Ages, the first veterinarians were farriers, and since then, the two professions have diverged, and now we have two separate entities. Currently, there's a swing towards new specialty groups within the farrier industry, so you're seeing more practices lean towards podiatry-specific work, and then you have the emergence of the veterinarians or the vet farriers, such as myself, who are trying to combine those two skill sets so you can deal with more specialized cases by understanding the pathology and being able to apply that mechanically. The Equine Veterinary Podiatry Group, which was established in 2014, is now making a move to try to create a board certification through the American College of Veterinary Medicine in equine podiatry. This is still something that's in the works. So just a couple examples, like, shoes of the past. You have a rope and cock shoe that was used, I don't know, in the Dark Ages, sometime in England, as a traction device. And on the bottom, you have a 3D printed shoe, which is made out of a special polymer. It's super lightweight, very durable, and it's printed by a computer specific for that horse's foot. So that's kind of the direction things are going in. So now I'm going to jump into the podiatry examination. If you don't recognize the trees in these pictures, they're from another hemisphere. This is actually my horse. So I start off a podiatry examination the same way I start off any examination. I just take over my initial impression of the horse: age, breed, sex, what's its temperament, what's its body condition. Horses that are a little bit overweight tend to be predisposed to certain problems. And then I want to talk to the owner. I want to find out if this horse has pre-existing lameness issues, what's its stage of training, or what type of workload is it undergoing. And then I want to know what the owner's expectations are. Is this a horse that we're happy for it to be pasture sound? Or is it a horse that needs to return to a high level of performance? Then I want to look at the entire conformation of the horse. So what is its stance? Is it weight shifting? How frequently is it weight shifting? Is it pointing one foot, trying to take weight off of it? I want to look at the angle of the hoof in relation to the distal limb, or as we refer to it as the hoof pastern axis. Does the horse have mismatched feet? Is one more upright? Is one lower? Are there angular limb variations that are going to influence this animal's gait or predispose it to certain lamenesses? And then we'll do the same series of manipulations we would do in any normal lameness exam. We're going to look at this animal's loading pattern at the walk and trot. We'll perform flexion tests. We can use heel and toe wedges to accentuate lameness issues to try to highlight those things. And then we'll watch the horse move in a circle and on different types of footing. Our distal limb evaluation involves this kind of a similar thing, palpating tendons, ligaments, and joints. We're looking for the presence of distal limb edema or joint effusion, or maybe thickening through the tendons. Very importantly, we want to palpate the digital pulses. So horses have a vein and artery and a nerve that run down either side of every leg. And in certain disease states or elevated states of inflammation, those pulses will start throbbing. Now, say we have a unilateral problem, a lot of times we'll have a pulse in just one foot. That's not a hard and fast rule, or say on a horse that has laminitis, you may have problems in both front feet. So feeling those pulses starts to point us in a direction. The next thing I want to palpate is the coronary band. And that's really important, especially in laminitis, because that disease is characterized by displacement of the coffin bone, or that bone within the hoof capsule. And if you look at the picture on the upper right, this horse is what we would call a sinker. So that bone in the foot is sinking down in the hoof capsule, and you can see that divot between the hairline and the hoof capsule. So those are all things that we're paying attention to right away in our examination. And I'll apologize now. There are a couple different terms for the coffin bone, or the bone within the hoof capsule. So there's the coffin bone, the pedal bone, or P3. So I'll try not to use them too interchangeably, but if anybody gets confused, please say so. Next, we'll move on to the hoof wall evaluation. So I want to look at the hoof quality. Are there cracks, presence of growth rings, the divergence of growth rings? And I'll explain that. If you look at this picture here, you can see that the growth rings in this foot are really pinched in the front half of the foot, but they're more spread out in the heel. And that indicates that it's growing faster in the heel region. We see this a lot in laminitic feet and additionally in club feet. The next thing I want to look at is the coronary band angle, or the contour. Sometimes we'll see a shunting upward of the coronary band in some areas, and that can be indicative of asymmetric loading. So it's going to essentially push the coronary band up. And these are all clues to lameness diagnosis, just things that we're looking for just through observation. Next, we'll move into the solar surface evaluation. So I'll take hoof testers, my fingers, and I'm just looking for areas of localized pain, or even when you're using your fingers tracing around the coronary band, is there an injury or a lesion or something like that? I'll look at the white line, this area in here, the conformation and orientation of the frog, and that in conjunction with the contour and quality of the sole can also give me an indicator as to what the relative position of the coffin bone is within the foot. We'll also look at the overall moisture content, the coloration, is there evidence of bruising or injury? So now I'll get a little into the radiographic examination. I think this is really important for you guys to understand because it's something that we do quite frequently where we'll take radiographs for the farrier to try to help get all these bones aligned properly. So this is a lateral view. It's shot just kind of from side to side through this foot. The first thing I want to assess is the bony column alignment. So kind of from top to bottom, you have P1, P2, and P3. P stands for phalanx. And then on the back here, this is your navicular bone. So what I want to see is that these bones are all in a relatively straight alignment. If the joints or the bones are deviating forward of that line, we would say that horse has a broken forward hoof pastern axis. But if they're deviating backward, that would be called a broken back hoof pastern axis. And those all have different effects on the strain on the tendons and ligaments within the foot. The next thing I want to look at is the sole depth under the tip of the pedal bone. This is really important because this tells me how much mass within the foot is available to protect the foot from concussive forces. So I like to see a minimum of 15 millimeters in feet, but that's not a hard and fast rule, but that's kind of my guideline. If they have more, that's great too. But there are drawbacks from having too much as well. In some cases, I will measure it kind of towards the back half of the foot as well, depending on what the overall conformation of that foot is. I'll next look at the dorsal hoof wall width. So that area, and all around the foot, that bone is suspended within the hoof capsule by an interdigitation between sensitive and insensitive structures. When those structures become inflamed, they begin to separate, or they widen that area. And in some cases, you'll see that done in an asymmetric fashion, where this is wider down here than it is up here. That would be indicative of rotation of that bone. But sometimes you just see a widening, an overall widening of that area, and that can be an early clue to say something like a sinker or uniform displacement within the hoof capsule. Then I want to look at the palmar or plantar angle of the foot. Plantar being for hind foot, palmar being for front foot. This horse has what we would call a positive palmar angle. So the toe is just slightly lower than the heel. Most horses range in a 3 to 5 degree natural palmar angle. Some schools of thought argue that it should be 0. My overarching goal is what's best for the bony column alignment and the overall comfort of this horse. All right, sorry. And then finally, I'm going to look at the weight distribution around the center of rotation of this joint. And if I were to drop a line down the center of the joint, I'd like to see 50% of the foot be in front of that and 50% be behind. I won't get too much into physics, but we can talk about moment arms and things like that. And if this horse has a really long toe out in front of that center of rotation, we have an increased leverage force or an increased moment arm on that joint. So we like to try to just keep everything as balanced as we can around that center of rotation. This is a bad example. So you can see right here, this horse has a really broken back, hoof pastern axis. And then additionally, it has what we call a negative palmar angle. So the heels are lower than the toe. And you see this despite this horse having a heel wedge on the shoe. So that indicates to me that, A, we're not helping that problem, and we might actually be loading that compromised area more. And so we have to alter our mechanics and so that we are actually aligning those bones better without increasing the load in that region. This is an example of a clubfoot, and you can see how broken forward that hoof pastern axis is, and how upright and how extreme that elevated palmar angle is. Next, we'll look at the dorsopalmar view. So this is just kind of a front to back view. And so what we're looking at is the patellar coffin bone in relationship to the ground surface, and then to the other bones and joints as well. So, I kind of take a line and draw it across the bottom of the coffin bone, and then I'll move up and look at that joint space and see, is that parallel? Or are these spaces even? Or is there pinching like you can see over here in this corner? Angular limb variations can have an effect on this, so you have to be a little bit careful with your interpretation. But it does give us some indicators as to what appropriate medial-lateral balance should be for this animal, or side-to-side balance. So the shoes and the trim are determined by many factors, the horse's discipline being one of them. What's the stage in this horse's preparation? And what's the horse's environment and management strategy at home? What's the ground surface like, or the average moisture content where this horse lives and works? And does this horse have any pre-existing conformational faults or lameness issues? And then we have to take all of that and roll it into what is the owner's budget? What is their commitment or ability to even manage this condition? And what are their expectations again? So the goals for our trim, we want to maintain foot mass, promote growth, and try to do so. We'd like to see even growth from toe to heel, and we can manipulate our mechanics to facilitate that. We want to preserve adequate frog mass, prevent cracking and chipping, and then maintain appropriate bony column alignment.
One question.
Yeah.
How do you prevent cracking and chipping?
Well, some of that has to do with the overall health and moisture content of the hoof capsule. If it's a barefoot horse, you can bevel the bottom surface of that foot more, which helps minimize those loose edges that can get caught on things. And then if it's a shod horse, you might just change how that shoe is fit or how it's nailed, because the nailing pattern can influence cracking and chipping as well. So shoes can be made of any number of materials, and they can also be configured in a number of different ways. So heart bars, egg bars, I won't go through each shoe type with you guys, but we'll use a couple examples as we move forward. And then the shoes can be modified. You can put clips on them. You see clips quite frequently. Clips reduce the shearing force on the nails, and they can kind of help hold the shoe in place. We can also alter the toe of the shoe to change what we call breakover, and I'll explain that term in a minute. And then we can nail these shoes on, glue them, or even shoes like these soft rides here, they can be used for temporary use, and they're just strapped on with Velcro, or some of you may ride your horses in boots. So they're just meant to be on temporarily. So just remember that we're shooting for a 4 to 6 week cycle. I know it used to be 8. Some people think it's 10 or 12, but that's not necessarily a good thing for your horse. The foot's a dynamic structure, and as soon as it grows, it's already growing out of balance. That lever arm's getting longer, and depending on your horse's natural conformation, you're going to need to maintain that horse in a certain level of what we call mechanics. So it's really important for performance horses and very important for horses that have lameness issues. So what can we change with shoeing? I think there's 4 main categories. You can break these down a little bit further, but we start with protection, dissipating concussive forces, leverage, and then load distribution. So protection, I think that's pretty self-explanatory, but we want to keep sensitive structures off the ground, minimize wear on the hoof capsule. We can use pads to achieve this. We can also use certain materials to create artificial sole depth. This is just an example here. It's a liquid polymer that's put into this foot. This is Play-Doh over here because what we were trying to keep that area open because it's a treatment port for an injured foot. We didn't want to fill it with that liquid polymer. And then this is a foot cast that's been applied to a horse that injured its hoof capsule, and we've got a shoe placed over the front of it. But any normal shoe that goes on your horse's foot is a form of protection. When we talk about dissipating concussive forces, we get a little more into the materials that shoes are made out of. Steel shoes have been shown to produce higher levels of vibration in a horse's foot as compared to aluminum shoes. That being said, aluminum shoes wear a lot faster, they're much more expensive, and they may not be ideal for the horse's intended use. But then you have shoes, there's polyurethane shoes out there on the market now that are really simple, you know, great for shock absorption, much easier to shape than some things. Those there's just other alternatives to dissipate those forces. Then we can use impression materials. I don't know if you've seen those two-part putties we mix together sometimes and put in their foot, or sole packs such as in this picture, and that's just that liquid polymer. But you're just creating a greater surface area to spread those forces across when that foot lands on the ground. And down here you just have an example of a leather pad versus, say, a plastic pad. They all have different properties, how they affect the foot when it hits the ground. Now I'll talk a little bit about leverage forces themselves and just explain the term breakover. So Hillary Clayton, she's a world-renowned researcher at Michigan State University. She defines breakover as that point that the heels leave the ground and start to rotate around the toe of the hoof while that toe is still in contact with the ground. And we have several different examples of breakover points here. So the one on the far left, you can see that that toe is really flared. It's kind of sticking out in front of that foot. That leverage or moment arm is further out in front of the foot, right where that arrow is. Then if we move over one picture, you have this foot that's been nicely trimmed, the shoe's perimeter fit, so to speak. It fits flush with the toe. So we've moved that breakover point further back, closer to the bony column and closer to the center of rotation of that foot. And then in the final picture, we have a much more extreme example. You have this shoe that's actually set back behind the toe. And then additionally, this shoe is made out of thick aluminum, and there's a bevel ground into the front of that toe. So we've moved a breakover point from where we've placed the shoe even further back, just simply because of the mechanics we've placed in this shoe. So we can alter breakover with our trim, with our shoe placement on the foot, and then additionally through the use of these types of shoes or modifications that we can put on regular horseshoes. And this is just an example. This is a toe crack on a broodmare somewhere far, far away from here in Australia. And it's just an example of how leverage forces how we can manipulate these leverage forces. Toe cracks actually generally start at the coronary band, and in some cases they do start from that foot stretching out, and then you have small cracks that form, and then they can propagate upward. So this horse, what we did for her, I mean, she was trimmed. I'll show you another picture in a second, but she's shod in, this is just a aluminum heart bar. It's got what we call rails on it, so these are angled, but we've moved the breakover point back here, which is pretty close to the center of rotation of her foot. You have a continuous shoe that provides stability for this hoof capsule, and then we have a frog plate in here which incorporates the frog as part of the load-bearing structure in that foot. And then there's a leather pad in there with some impression material that dissipates those concussive forces. And this is another example of it here. After we clean the crack out, and then we used a plate to stabilize this. You can also use fiberglass and different polymers to do that. I think it's a little easier, honestly. But by boring that crack out too, we prevent those leverage forces from creating motion.
Does that hurt the horse?
No, it can if you use too long of a screw. Yeah, the screws are designed.
The crack itself.
Yeah, it does, because this is a full thickness toe crack, so that's very unstable. You may see smaller toe cracks in some of your horses. You know, some of them are just more cosmetic than anything else, and the horse just probably needs to be trimmed more frequently. But in this case, yeah, this is full thickness, so any form of motion is going to cause pain for this animal. So by preventing those things from being able to rub against each other and stabilizing that hoof crack, the foot can actually now grow that out. Because the horse grows the foot from the coronary band down. It's not going to heal from side to side. So we just need to keep that as stable as possible while the horse generates a new hoof wall. Little more about leverage forces. Heel elevation. I think a lot of you have probably had the therapeutic shoes where you say, let's wedge them up. So how does shoeing affect tendons and ligaments? You have three different, two major tendons and one ligament that runs down the back of the leg. The deep digital flexor tendon, the superficial flexor tendon, and the suspensory ligament. They all act a little bit differently, and that's based on their attachment points. The deep digital flexor tendon attaches to the bottom of the coffin bone. So when we wedge that heel, we relieve tension on that tendon. This also relieves tension on the navicular bone and the soft tissue structures in the back half of the foot that we kind of saw in that x-ray earlier. But consequently, we do start to load the superficial flexor tendon and the suspensory ligament more because those two attach at different places and act in a little bit different fashion. So whenever we're making a decision for a foot, we have to be really cognizant of what the problem is and how that may impact the other structures that we're dealing with. This is an example. I'm sure anybody who owns a thoroughbred has probably seen this. Kind of a long toe, low heel syndrome. So this horse has a broken back hoof pastern axis, really negative palmar angle, and he's got a little arthritic or fragment in this coffin joint too, which probably isn't helping. So what we've done is you can use a solid wedge, but with this particular horse, we put a belly in the shoe or a rocker in the shoe right underneath the center of articulation. And it's only just a subtle rocker, but what we've been able to do is create a more uniform hoof pastern axis. We're actually be able to significantly improve this palmar angle. So there's more than one way to do these things. This is just this particular example. Yeah. So while I was in Australia, I really had the fortunate luck to be able to look at tons and tons of foals. These farms foal out over 100 foals per farm usually, and we would go to these farms and we could assess and tram anywhere from 30 to 60 foals in a matter of hours. And we're assessing their conformation, we're trimming them, we're making decisions for them in terms of orthotics, whether or not they need surgery. And then we're able to watch all those things over time as these animals mature and get ready to go to sales or get ready to go into training. So it's actually really interesting. So just briefly, angular versus flexural limb deformities. On the far left, that is a flexural limb deformity. It's tendon laxity in a young foal. And those are deformities that are viewed from the side. Angular limb deformities are similar to this foal on the right. This foal has a carpal valgus conformation, so you can just see that deviation outward from the knees of this foal. And so the angular limb deformities are those that we're viewing from the front. So for this type of scenario, a lot of what these foals need is just to strengthen up. But we can help them by applying, say, a cuff or some kind of heel extension that just provides them with a little bit of extra support while those muscles strengthen. And it also minimizes the trauma to the soft tissue structures as they're growing. And usually we only have to leave these cuffs on temporarily just for, we take them on, put them on, take them off, every 24 hours or so. Just over the matter of a couple weeks, and then eventually they'd strengthen up. We have to make all these orthotic and surgical decisions based on the joint involved. Usually you can't really affect anything above a fetlock with your orthotics when you're talking about these types of scenarios. So if you come to me with a crazy knee, I'm probably going to go, you should go see somebody else. But then we're looking at the severity of the conformational defect. Are our orthotics even going to make a difference should this animal go to surgery? And then we want to talk about the age of the foal because it's really important to make these changes in relevance to the growth plate closure times. And this is why we don't try to manipulate the conformation in older horses. So if your horse looks like this, we're not going to fix it. Yes?
When you repair the foal and it takes, does that last
have to, there's things you have to be cognizant of. Say horses that are really upright as foals, we can manage them for a period of time, but we have to be very cautious of them during growth spurts, because sometimes they will just kind of come up and over and you can see really severe club feet develop. But yes, the effects are usually pretty good. And a lot of this is getting horses so that they look appropriate for sales when you're dealing with the thoroughbred industry. There's a lot of that, because there's definitely a perception about what their conformation does for their long-term racing performance. Now I'm just going to talk about load distribution. So using our shoes to move pressure away from damaged or compromised areas. And then we talk about moving load toward, so areas under tension, say tendons and ligaments, if we move load towards that area, we actually decrease, the strain on those tendons and ligaments. Whereas if you have areas that are injured by compression, say arthritis or areas like this, we want to move the load away from that. So this horse quartered itself, kind of pulled off part of its hoof capsule. And so what we've done with this particular horse is we've put it in a heart bar shoe. Once again, it's a continuous shoe. It's aluminum, so it's lightweight. And then it's got this heart bar insert. So we've, again, incorporated the frog as part of our load-bearing structure. And so this is, can protect the foot over time while it grows, and it's easy to bandage, easy to change. So it's great. Down here on the left, you have a foot cast, or the bottom of a foot cast, and it just looks like a big red blob. But we'll use these in a lot of laminitic cases. So if you have a horse that's displacing distally or sinking in the hoof capsule, you can use a hoof cast or even a distal limb cast to put on this foot. And what it does is it transfers the load more to the cast rather than specifically to the limb and those compromised structures. And there's different ways to manipulate those casts to achieve this effect. Not that sinkers are easy to manage any way you slice it, but so that's just that hoof wall avulsion sometime later, probably a month or a month and a half later. And then I'll just get back into angular limb deformities a little bit. This is where you can kind of use load distribution to help with the angular portion of this. So that foal on the far right, if you look down at his fetlocks and down at his feet, you can see that he's just kind of turned in. So he's already got a tendency to be quite pigeon-toed. We call that a fetlock varus conformation, very common. That's one that we will try to manipulate. Fetlock varus, or excuse me, fetlock valgus, we're not going to try to manipulate. Because as that foal grows, its chest is going to widen and its feet are going to come in. So we're not going to try to force that when they're young, because otherwise you can end up with bigger problems. So we don't manipulate fetlock valgus. But when they're turned in like that, we will try to rotate them out a little bit. And so what we're doing here, we're gluing on a foal extension. It's a lateral extension. It comes out like a little wing on the side of this foal's foot. And what it's doing is it's shifting a load kind of to the outside of that foot. So when that foal lands in soft footing, it also kind of adjusts the breakover point. And you can see a picture of this here. This foal is forcing that limb to rotate a little bit outward. And while their growth plates are open, that's okay to do. We usually only leave these on for a couple of weeks. And then if they're not effective, we'll start moving into, they did a lot of a procedure called periosteal stripping in Australia, but you can also do different things to manipulate those growth plates surgically. Another example for load distribution, this is a horse with white line disease, what appears to be a very small crack on the surface. If you look at the foot from the underside, you can see a lot of that's quite underrun. And if you were to tap on that hoof capsule with a hammer or something like that, you would hear a very hollow sound. And what white line disease is an opportunistic bacteria. There's no specific bacteria identified, but these bacteria and fungi get up into that region and completely undermine it. And that can be pretty painful if it destabilizes the hoof capsule itself. So in order to treat that, we have to expose that area to air and be able to kill that bacteria or fungus. And then we've placed this horse in a supportive shoe. And I'll show you another picture of it a little closer up. This is his horse, I think 6 weeks out. It's really muddy because the horse has been running around like this. But what we have is a fiberglass cuff that runs up over this diseased area and around the other side of the foot, attaches it to an aluminum shoe, And then you have sole pack underneath to help with load distribution, but you can see that this whole area is floated or the pressure's been relieved from that. So it minimizes pain from destabilization of the hoof capsule. Okay, now I'm going to get into laminitis. And this is where we can tie a lot of these concepts together. So as I mentioned before, the coffin bone is attached to the hoof wall by very small interdigitations between the dermal and epidermal tissues of the foot. And these are called lamellae. When they're inflamed, that's where we term it laminitis. Another term for laminitis is founder. You've probably heard that term, but I think, I tend to stick to this. It's a little more specific. But you may have heard it referred to as founder as well. Anyway, these leaflets support the entire weight of the horse. And when these tissues break down, so can the attachment between the bone and the hoof wall. And that bone can actually rotate through the bottom of the foot. It's a devastating disease. And so this is just an example. This is a model that I made while I was in Australia. So this is, you can see the striations in that middle foot. That's all soft tissue. Those are all those little tiny leaflets on the soft tissue side of the foot. The hoof capsule on the right, you can see that those interdigitations are mirrored in the insensitive structures in the hoof capsule. The foot is an amazing mechanical mechanism, how it suspends itself like that. And there's a hoof capsule over there on the table if you want to get an idea of, you can look inside it and get an idea of what those interdigitations look like. So, in the normal foot, we want to have a parallel relationship between the dorsal or front surface of the hoof wall and the coffin bone itself. In the diseased foot, you can see that that relationship has been lost. And what happens when those forces break down, the antagonist force, so the deep digital flexor tendon that runs down the back of the leg and attaches here, becomes the overarching or overriding force. And so what we have to do is try to figure out how to remove that antagonist. So what we've done here is we've put this horse in a really high, it's a 20-degree wedge, and essentially we're trying to unload that tendon so that it's no longer causing those distractive forces on the foot. And that also aids in the reestablishment of circulation for the foot as well. And so this just shows you kind of what the discrepancy is between, those two measurements. And then I'll just have you guys note that here at the bottom of this foot here, there's a lot of dark lines. That's indicative of gas, fluid accumulation, and that foot's actually getting ready to come through the bottom there. So that horse is in a lot of trouble. And you can actually start to see some remodeling to that bone itself. So, laminitis, there's 4 main causes. The one that we see most commonly is metabolically mediated, Cushing's disease, and equine metabolic syndrome. So when we tell you your horses are fat, we're doing it for a reason. But these diseases are both mediated by insulin resistance, and that's kind of the key factor that we're trying to manage over time. Endotoxemia or systemic sepsis, that's another serious cause of laminitis. The horses can get that from retained placenta, or some of you may have experienced that with a horse that's had colic surgery. Then we talk about support limb laminitis. When we talk about Barbaro broke his leg, but what actually ended up killing him was the other leg, because he was weight bearing on the other leg so long that lamellar attachment broke away and that bone started to displace. And once that happens, it's a very tough road. And then you can have traumatic laminitis, and it has a lot to do with concussion and impact forces. And actually you see this in a lot of wild horses, and I will get into that, because I think there is a perception out there that wild horses are laminitis free, and that is definitely not the case. So for our laminitic horses, we want to identify the cause and the risk factors. We're going to perform a series of diagnostics, and then we're going to make treatment and shoeing decisions based upon that. Traditionally, we use radiographs in the field, So we're looking for evidence of rotation or sinking, those forms of displacement that I mentioned. But sometimes it's really subtle, and you're not seeing big changes, but you know there's a problem there. So there's a tool that I like to employ called the Venogram. So the bone is enveloped in a huge array of vascular structures, blood vessels. And when that bone displaces, those blood vessels tear. And so you start to see, or they're compressed. So what I'll do is I'll put a tourniquet around the fetlock, and then you inject hyperosmolar contrast material into the foot, which shows up on an X-ray. And that enables us to visualize what's going on with the vasculature in the foot. So I can generate an image like this. This is a severely diseased foot. And I'll show you a normal foot in a second. But it gives me an idea of which areas are under load, which areas are the most compromised. And then we can start to make shoeing decisions to try to alleviate pressure in those specific areas. And we can use serial venograms to see if our treatment decisions are actually having an impact on that foot. So this is a normal venogram on the left. You can see that there's a lot of fill around the coronary band. And then there's this nice discrete line of vasculature surrounding the coffin bone. Then we move over to this on the right, and you can see that there's just an area of complete shutdown here. And that has to do with how the foot is displacing. Then if we go down along the dorsal lamellar complex, you can see that there's stretching and leakage of contrast material likely associated with the bone moving like this in the hoof capsule. There's a lot of shutdown here and a lot of blackout through here as well, which means that that foot is putting direct pressure on those blood vessels, or they've been torn and compromised. So it's another useful tool that we have to interpret in light of all of our clinical findings, but I find it useful. So getting back into some of the things we talked about, in a foot that is actively rotating or separating from the hoof wall in this fashion, we'll try to quote-unquote derotate the foot. So it's thought that if we manipulate the hoof capsule to establish the zero or a parallel palmar angle between the pedal bone and the bearing surface of the shoe, we're going to optimize vascular fill within the foot. So I'll just kind of briefly explain what that is. This is the same foot in this elevated wedge shoe. And so we've done that to relieve tension on the tendon. So here you can see that that bone is tipped down. Most of the load is kind of coming through the front of that bone, which is a really compromised area. So on the foot on the left, we've inserted a wedge underneath the toe of the foot. That wedge isn't going to stay there. It's only a placement tool. So then we've reestablished that parallel relationship between these two structures while still maintaining relief on the deep digital flexor tendon. It seems a little counterintuitive, but it's kind of the difference between standing in your heels or standing on a wedge of some kind. And then we remove that little triangle there, and all of a sudden you have no compressive forces at all in that area. You just have an airspace. We don't do that with all of them, but that's just this particular example. In some cases, we're forced to completely remove that distractive force of the deep digital flexor tendon. And this is an image of a deep digital flexor tenotomy. So it's a procedure that's done standing. You isolate the tendon and then you can actually cut it. Horses do live quite well beyond this. Usually they don't return to athletic function, but if you're trying to preserve the breeding life of a mare or you want to keep something as a pasture ornament, you really want to give it the best shot possible, this is definitely a tool we use. And I've done some work on looking at venograms before and after tenotomies, and we do see a positive response in terms of vascular fill. Okay, so just remember, prevention is in your hands. Now we move on to, does your horse need shoes? There's a large number of horses that can go without shoes without any problems. And you need to ask yourself how much you're riding your horse, what surfaces does your horse work on, and is there an underlying condition we need to compensate for? Or do you even own a horse? So now the barefoot debate. there's a lot of controversy between traditional farriers and barefoot trimmers right now. I would argue, and I think you've seen tonight, that shoeing is really indicated when wear exceeds growth, and boots do count as shoes, some form of protection, and if there's a pathologic condition that exists in which the shoe serves a therapeutic purpose. So, is the wild horse foot the perfect model? There's a lot of researchers around the US. Sometimes I would call them more observers. They're people who have spent their lives studying wild horse feet, but mostly from an external viewpoint. And they're also studying these horses in one particular environment or one population of horses. And that's not necessarily representative of the larger population of horses across the world or in different environments. So while I was in Australia, I went to the Functional Hoof Care Conference, which was hosted by a group of barefoot trimmers in Australia. There's a number of excellent speakers, but the most important is the one at the end, or the one that I took the most away from, was Brian Hampson, who did his PhD on wild horse feet, looking at different populations in Australia. He did his PhD work under Chris Pollitt, who's a world-renowned laminitis researcher. So Hampson looked at Australian Brumbies and Kaimanawa horses for this particular PhD project. He did 14 different studies of significant numbers of wild horses, and he looked at the genetic structure, the travel profile, the nutritional health parameters, and how all these things had an impact on these horses' feet. And one of the biggest things that he found, I mean, there's more to it, but the gross appearance of the feet were really affected by the substrate or the surface these horses lived on and the travel distance that they had between feet and water. And some of these horses were moving anywhere from 15 kilometers to 50 kilometers to get to food and water. And what was interesting is we talk about that perfect little Mustang foot that you see on the internet, and it's got a nice short hoof wall and it's perfectly beveled and the quarters are scooped out. That's one foot. That's one foot that he found that for horses that were in high travel environments and arid environments. Then you had another type of foot that he described where it's a little bit longer, it's cracked, it's flared, it's a little bit different. And then he did what we call the Brumpy swap. He took these two different types of feet and he swapped the environments. And the feet changed to mirror the environment that they were in. Then he got even further into it. He examined these feet radiographically. He took representative samples of horses and examined their feet histologically. So they actually euthanized some of these horses and cut into their feet and looked at the tissues and found that the incidence of chronic laminitis in these feet were as high as 40 to 93% in some of these Australian Brumbies and as high as 45% in the Kaimanawa horses of New Zealand. Not all of these horses were lame as in laminitic horses we see, and that may speak to how the hoof mechanism compensates for that, but the disease is present in wild horses, and it's present in high numbers. So when people tell you that laminitis doesn't exist in wild horses, they're telling you a story. And what's funny is the feet that actually had the highest rates of the worst disease process were those perfect little Mustang feet without the little cracks and chips. Those were the ones that had the worst pathology. And the ones that were a little uglier on the outside, they were a little uglier on the outside, but they were much healthier on the inside. So I took a lot away from that. And Brian Hampson showed us a lot of feet that he's just looked at from all around the world in one of his talks. And I just thought it was really interesting because they were all very, very different. So I just think that, when we're reading all of these things, we have to be critical and start to ask ourselves the questions, are these personal observations? What are these based on? And does this apply to my horse? And I think that's a personal question for everyone. Yes?
Did they know how sound these horses were with the chronic laminitis?
They were doing pretty well. I think they didn't see, like I said, they didn't see a lot of horses standing out like this. But then you think about it, these horses are in the wild, so if they're not compensating, they're probably crashing. When we talk about the average lifespan of these animals, our horses in captivity, a lot of them are living to 30 now. The average lifespan of a horse in the wild, the last time I heard it, and I don't know if that's specific to Australian horses, it's about 16 years. So we do have to think about that as well. So tips to keeping your horse sound. Practice good management, diet and nutrition, very important. Pay attention to your horse's specific risk factors. Pick their feet out and examine them on a regular basis. Pay attention to the footing that you work them on and that they live in. And then you want to maintain them on a consistent shoeing and trimming cycle. So take-home messages. Shoes can be used for a variety of purposes. Not every horse needs shoes, but decisions should be based on each unique situation. Does anyone have any questions? Yes.
What about foot abscesses?
Foot abscesses.
The barn in which I volunteer at, there's a number of horses that are abscessed.
They're never abscessed?
They
Or?
are abscessed
Okay.
right now.
Yeah, so foot abscesses, what we generally see, there's two different types. You have what we call like a gravel, and that's usually an ascending infection that gets up between the hoof wall and the tracks up along the white line. So that's just a nidus of bacterial infection. It's a localized pocket. Then you have some that track under the sole, that actually go underneath the foot. I have a really good example of one in there somewhere. So it's just a localized infection from a specific bacteria.
And the treatment is?
You have to open it up, and you have to create drainage.
Definitely have to open up.
Well, I mean, you can poultice it. I think it depends on it. Like, I tend to not be very aggressive with foot abscesses right away. If I find a localized pocket of pain, if there isn't a defined tract, I will usually just poultice the foot first. Because if you're too aggressive opening it, that's a hole that needs to heal. And particularly with foot abscesses, or subsolar ones, if you open those up, you can create yourself a lot more problems. So drainage is key for abscesses.
Thanks.
Yeah. Yes. Oh, sorry.
So what does a set of radiographs cost? I mean, is that probably the most effective way to determine whether everything is in correct alignment?
Yeah, I'd say probably would run about $250 for a full set. We generally just do four X-rays, a front and side view of each one, and then whatever farm call or if your horse needs sedation.
And then you can make a recommendation on,
Yeah.
on what kind of training. Because I've got two horses that are full brothers, and so they're kept in the exact same conditions, but one has a much more upright
Yep.
hoof shape and is prone to getting crushed, and the other one has a much more open shaped hoof.
Yeah.
And so, I do try to be cognizant of, turning them out when it's wet, and then
Yeah.
putting them in,
Mhm.
the feet dry.
Yeah.
But it's interesting how hoof shape makes a big difference. And then, of course, the horse that has a more upright hoof tends to be more easily succumb to like contracted heels as well.
Yeah.
But they're both barefoot, and I find that keeping them barefoot really helps with
Yeah.
preventing that contraction in the heels.
Yeah, and I mean, unfortunately, a lot of times that upright contracted conformation, that has a lot to do with underlying genetics. So that's what you would technically term a clubfoot. There's different grades of clubfoot, so you may see some that are, don't look that bad, and then you may see the ones that look like deer feet. And unfortunately, that's a result of the tightening of the musculotendinous unit associated with the deep digital flexor tendon. So you can manipulate it with a trim, but we can also manipulate it with a shoe, but we manage those over time. We don't try to make those perfect because we can cause a lot more harm than good if we try to really rasp on things and make it look the way we want it to look. But yeah, no, I mean, that's great because you're right. Those types of feet are especially prone to thrush because there's things that are just getting stuck in there and not coming out.
The other interesting thing is that when he naturally wears his hooves down because he's barefoot, he's a super wide glide, so probably more prone to laminitis because he's crusty. But
Oh,
when
I was like, what's a wide glide? All right. Yeah,
super
yeah,
wide
yeah,
And very big body.
yeah.
And so when he wears his feet down because he's so wide, they wear down on the outside
Yep.
edges and then the insides are high.
Yeah, and so that's probably like a wide-chested horse. So we think of those horses being they're chest wide, but they're base narrow. So that loading is going to come down the outside of that limb, and that's exactly what you're seeing. And you have to compensate for that, but and take that into account. And we see the opposite in some of these horses that are, kind of base narrow, and they're loading through the center more. And those horses are prone to a whole different host of problems. Yes?
With the dryness this summer, my farrier recommended using like hoof dressing.
Yeah.
Something that you would say should be used all the time, or maybe in just an extreme condition like this?
I'd say extreme conditions. I hate to say it, but one of the most effective things is, letting the water tank overflow and just getting some moisture in there, which is, really bad for thrush, but if you have really dry feet, hoof dressing isn't going to hurt them to use it all the time, but it, may be more or less effective depending on what the needs of that foot are.
When you were in Australia with all those little foals, did you have a number of little foals that had club feet, and do you ever do anything with that one, or is it just something you really can't change?
No, there's definitely stuff you can do, and you can do it when they're young. You can start off, we'll do like what we call a rocker trim, or there's a small orthotic that you can use. And what you're actually trying to do, foals that are actually born really upright, we don't try to drop them down. We actually wedge them up more. And what that does is it relieves the tension on that musculotendinous unit, and then we gradually lower them down. Because part of that is a pain-mediated response. So that's kind of your early foal. And then we'll start to use like our trim and that orthotic to try to relieve a little tension on that tendon. But if it's really not responding to that sort of thing, you can do different surgeries. And one of that, it's a simple surgery, but you're actually cutting a ligament associated with the deep digital flexor tendon, and that relieves the tension. And the horse still has full athletic potential even after you cut that little ligament. And you can do that. You really don't want to do it much more than a year of age, but some people have had success with it doing it when they're older.
Is it considered to be a genetic issue? Do they inherit it, or is it?
Some of it's genetic. We also associate it with horses that are young and they're growing too rapidly, and we see that in a lot of these thoroughbred foals in the sense that they're being fed excessive amounts of food to try to put condition on them for sales and things, and all of a sudden they'll start to bulk up, and you see them just really trying to grow faster than they're really ready for.
Excuse me. Horse that has one club foot, and it's just the way she's barefoot and the way she's trimmed. She doesn't have a lame day in her life.
That's perfect.
Yeah, and I think it's just the way the farrier keeps her
Yeah.
trimmed, because it grows differently.
Yeah, and management over time, one of the biggest things we want to try to preserve in those types of feet is that sole depth I was talking about. Because the impact of that bone on the ground, you think about it, it's quite upright within the hoof capsule. If you wear that away, you start to damage the bone itself, and you'll see these chronic club feet over time. That bone will remodel, or you'll start to see it look like it's being eaten away radiographically because there's so much trauma to that bone. So we try to maintain them in a fashion that protects that bone as much as possible and try not to perpetuate that problem.
Did you say in the foal that it's pain mediated?
Yeah, so when they're really upright as a foal, there's a lot of tension in that, and it actually is painful for them. So when they're first born, if they're really upright, one of the things you can do is give them, we use Banamine in Australia, but you can use other drugs to try to, relax them a little bit more and help, decrease that pain response. You won't do it a lot, but, there is you have a long bone and a tendon and muscle unit that isn't the appropriate size for it. So there is a pain response involved with that.
Do they have to learn all this in farrier school? I can't believe
No.
it. I was going to say, wait a minute.
There are some people that are just a little more zealous about it than others.
I think most of the barefoot proponents love the fact that the hoof the circulation is so much better, and there's a lot of good things about it.
No, there definitely are. And I'm a huge proponent of horses that can be managed barefoot. Do it. But as I said, I think a lot of it is more observational than actual research. And I have read some of the barefoot stuff because I'm interested and I want to know what's out there. And I think some of the things I found frustrating, is sometimes there isn't really a full description of what the disease process is. Or like I read a book about Founder by one of the popular authors, and I was just a little frustrated because he kept referring to holistic changes. But by the time I was halfway through the book, he never really explained what those were. But then he was kind of like, everything the vets do is wrong, and you should let your horse eat fruits and vegetables. And you're like, all right, And so I found that to be, it's a one-sided story. But, you're saying, like, I need you to just demonstrate that you really understand the pathology and you really understand the problem, and that, your changes are really making an impact on that. But I think it's a great, thing overall. And I mean, that is the natural foot. And I think if we can maintain horses that way, it's fantastic. Yes.
So along those lines, I do have a barefoot horse.
Yeah.
And I think the challenge for me is just finding the right boot
Yeah.
for when I am riding in rocky areas.
Yeah.
I mean, he's great on the farm, but
Yeah.
so it's just trying to find the forum to find. I've tried a couple of different boots, and they all have their quirks, but I would love to hear from clients who have had success with different boots, but that's
Yeah.
hard
Yeah.
to find them.
Yeah, and I'd open the floor up to anyone who can offer that, because I'm always looking for different options, and particularly for people who want to keep their horses barefoot. The more I learn about these products that are available, the more I can say, hey, this has worked for somebody, but there is a vast number of products out there if you've ever gotten on the internet, and everyone has their own little twist on it.
Yeah.
And I think that's why, for me, there's a lot of different shoeing styles and shoeing strategies as well. So I try to bring it all back to the fundamental mechanics behind each one, and basically say, what are my goals for this horse, and how do I best achieve that? And a lot of times that's a conversation with the farrier too. You say, this is what I'm thinking for this foot. And then they kind of go, I don't really do that, but here, I'm comfortable doing this. And you realize it accomplishes the same goals. It just has a different sticker on it. But anybody who, has information about boots and stuff that they really like, that's useful information for all of us.
You mentioned 4 to 6 weeks on
Yeah,
trimming?
yeah. Yeah, I mean, that's a pretty tight schedule. I wouldn't go more than 8. Yeah, like I said, there's a lot of people who are like, oh, my farrier's great, my shoes have been on for 10 weeks. And you're like, that's because he's got more nails in it, because he's really trying hard to keep those shoes on. So,
What about those of us who actually would like to be on a 6 to 8 week schedule, but the farrier has it in 10 to 12?
Yeah. You have to talk to them about that. Yeah, I know, that's kind of the thing.
It seems to me that horses' feet grow more in the summer
Mhm.
in the weather.
Yeah.
Do they actually do that, or?
Yeah, no, they do, for sure. And I think it just has to do with, the natural progression of things, but that's something we definitely see. And we'll see their feet grow in response to different moisture environments and things like that as well. So, you talk to any farrier, they'll tell you how they grow. I have to say that, we have a lot of great farriers in this area, and I've worked with farriers all over the world at this point, and I have really never met such a group of honest, hardworking people that are constantly trying to improve what they do. And I think you really need to take that into account when you talk to your farrier. If you have a problem, call your farrier, talk to them about it. They want to do what's right for your horse. And I see that time and time again where people will bypass the farrier or just get a new farrier without even talking to them. Like I said, we have a lot of talent in this area. We're very lucky. So keep that door for conversation open. Sorry.
I do have a question. My biggest fear is the L word, laminitis.
Yeah.
Just to say the F word.
Yeah. Yeah.
And living in this area, I'm terrified of grass.
Yeah.
Because we don't get to have, like in Kentucky, the 10
Mhm.
acres where they can be on it 24/7 year round, and they
Yeah.
can just eat as the new grass comes in the spring.
Those horses have laminitis too, trust me.
I know, but if they're out
Yeah.
there all the time.
Yeah.
Their gut and their metabolism develops as the grass grows and as it changes. Whereas
Yeah.
here, we have our little dirt paddocks, and then when we're lucky, we get to put them on a
Yeah,
grass paddock.
yeah.
And I start with the 15 minutes in the spring, and then I, increase it by 5 minutes.
Yeah.
And then if I'm at work too long one day and I can't get out there at 11 at night to give them their 20 minutes, and
Yeah.
then I feel like, oh my God, they've missed the day. I gotta start the
Yeah.
clock all over again.
Yeah.
I mean, how much do I really have to worry about that? Because I've never had a foot problem, but I don't want a
Yeah,
foot
I mean, a
problem.
lot of like dumping them out on grass right away. There's two things we're worried about. Colic, that's a big one. But yeah, I mean, I think it's gonna have a lot to do with the specifics of your horse. Like what type of horse do you have? What sort of horse is it?
Well, Pippin. The buckskin
Oh,
jeans, the
sorry.
deal. That's okay.
Losing it. Everyone's out of context tonight. Sorry. Even I'm out of context. Yeah, so, I mean, I think we have to be careful of that. And there's certain breeds that are more or less predisposed. And looking at your horse's body condition or their body type is a big indicator right away as to whether or not they have insulin resistance issues. So if you have an older horse that looks like it may be cushingoid, get them tested. Find out where they're at and find out if we can manage that. If they're overweight, pay attention to that because it's really important, because that's what's going to affect their ability to metabolize those sugar spikes in the grass. So prevention, I guess, is kind of the best thing. But yeah, I would still be concerned about it.
And then grass this time of year, because we had the drought
Yeah.
this summer, now we've had the rain. Is this grass like spring grass? Or is
Yeah,
it
I mean, after a lot of rain, it starts to grow again. I mean, right now we're kind of dealing with these frosts, and the fluctuations in temperature actually cause the sugar levels in the grass to fluctuate. So, really crisp mornings, things like that, that tends to cause ebbs and flows in the sugar. Usually when you get towards the end of the summer, it's not quite so lush, but yeah, we're still seeing that. And then right now we're also seeing seasonal elevations in some of those hormone levels associated with Cushing's disease. I spoke to an internist recently, and we were talking about how that probably has some relationship to the spikes, some of the fall spikes in laminitis that we see. So, yes.
We just were chatting about frosted grass, and is that higher in sugar? I always heard, don't put them out on frosted grass.
Yeah.
But then the rest of the season, you want to have them out in the morning before the sugars rise.
Yeah.
So is there any?
Oh yeah. I mean, honestly, I have to think about that one. But yeah.
Stress grass.
What's that?
Frosted grass.
Okay. So there you go. Yeah.
So the sugar should be higher in frosted grass.
Yes. Yeah.
Yeah.
So. All right. Okay. Well, thank you guys very much for your attention.